Hello friends, welcome to Voice to Nurses. Today we are going to discuss about some previous questions which will help you for to get high marks in any nursing competitive examinations like JIPMER, AIMS, CHO examinations and railway, ESIC and all nursing competitive examinations. First question, when considering the principle of growth and development, remember that. When considering the principle of growth and development, remember that. Options, although development occurs in an orderly sequence, the rate may vary between individuals. Second option, most children can run before they walk. Third option, development occurs evenly with periods of no growth occurring every third year. And the fourth option, all children should grow in the same rate. All 4-year-old should weigh within 4 kg of each other. These all are the options. Answer is option A. Although development occurs in an orderly sequence, the rate may vary between individuals. Second question, secondary prevention is option A, safe water supply, vector and animal reservoir control. Option B, early detection or diagnosis of disease and prompt treatment. Option C, good living and working condition. Option D, nutritional counseling. Secondary prevention, answer is option B, early detection or diagnosis of disease and prompt treatment. Third question, the reflex action of the toes is indicative of abnormalities in the motor control pathway leading from cerebral cortex. The reflex action of the toes is indicative of abnormalities in the motor control pathway leading from cerebral cortex. Options, option A, Romberg test. Option B, patellar reflex. Option C, Babinski reflex. Option D, Achilles reflex. Answer option C, Babinski reflex. Fourth question, nurse use the nursing process as a method of. Nurse use the nursing process as a method of. Option A, planning, organizing and delivering patient care. Communicating with patients and families. Option C, meeting the legal requirements and standards in nursing. Option D, meeting public expectations of nurse. Here the answer is planning, organizing and delivering patient care. The term nursing process is coined by Lydia Hall. Steps in nursing process are assessment, diagnosis, planning, implementation and evaluation. Fifth question, which of the following would not promote trust in the nurse-patient relationship? Which of the following would not promote trust in the nurse-patient relationship? Option A, examining a wound without providing privacy. Option B, fulfilling promises. Option C, returning at the stated time. And option D, maintaining confidentiality. Answer is option A, examining a wound without providing privacy. Sixth question, which of the following is the most abundant type of blood cells? Which of the following is the most abundant type of blood cells? Options, monocyte, erythrocyte, lymphocyte and thrombocyte. Answer is erythrocyte, WBC. The normal count is about 4.5 to 5 cubic millimeter. Every second in an adult body, 2.4 millions of erythrocytes or RBCs are produced. The production of erythrocyte is known as erythropoiesis. Next question, the term para is defined as. Options, total number of pregnancies. Option B, born from beginning of 38 to 42 weeks. Option C, any pregnancy terminates before the period of viability. and option D, number of past pregnancies gone beyond the period of viability. Answer is option D, number of past pregnancies gone beyond period of viability. Everyone should remember one thing, there is a scoring GTPAL, GTPAL, which corresponds to the number of pregnancies, the number of term deliveries, and the number of preterm deliveries and all. Do remember that. Seventh question, role of community health nurse in school health program. Except role of community health nurse in school health program. Except option A, assist in school medical examination and follow-up, assisting screening, physical, mental and other special examination of children in school, assisting communicable disease control program, and to provide immunization to the children. Answer is option D, to provide immunization to the children. Next question, a significant predictor of fetal well-being if the heart rate is. A significant predictor of fetal well-being if the heart rate is. The normal fetal heart rate they are asking. Options 100 to 120 beats per minute. Option B 180 to 200 beats per minute. Option C 120 to 160 beats per minute. And option D 160 to 200 beats per minute. The answer is normal fetal heart rate. The answer is option C 120 to 160 beats per minute. If it goes less than 90, then the fetus will be in a very acute stage of fetal distress. So less than 110, we have to be alert. Next question. The major nutrients involved in fluid balance. Major nutrients involved in fluid balance. Vitamin B9 and magnesium. Option B, fats and proteins. Option C, chloride and carbohydrates. And option D, potassium and sodium. Fluid balance. The major nutrients involved in fluid balance. The answer is potassium and sodium. Option D. Next question. Cervical encirclage is done for patients with. Cervical encirclage is a surgical procedure with the suturing of cervical area. It is done for patients with options complete abortion, threatened abortion, incomplete abortion, and incompetent cervix. The answer is option D, incompetent cervix. Next question. Bipolar disorders are treated with the following medications. Except bipolar disorders are treated with the following medications except options. Option A, carbamazepine. Option B, valproic acid. Option C, amphetamine. And option D, lithium. Answer is amphetamine. We will give carbamazepine, valproic acid and lithium carbonate to patients with bipolar disorders for their treatment. Next question. Rh negative mother should receive dash globulin. Rh negative mother should receive dash globulin. RHOM globulin, RHOD globulin, lecithin or sphingomyelin, acetylcholine esterase. The answer is option B, RHOD immunoglobulin. RHOD immunoglobulin. Rhesus factor O, D immunoglobulin. Next question. Complete dilation of cervix complete dilation of, sorry, it is the cervix. Complete dilation of cervix to birth of baby is staged as. Complete dilatation of cervix to birth of baby is staged as. At what stage the dilation of cervix will be complete? That is the 10 centimeter dilatation. When will it reach? Okay, at which stage? Option A, stage 4 of labor, stage 3 of labor, and stage 1 of labor. The last option is stage 2 of labor. Complete dilation of cervix, it will reach by which stage? Stage 2 of labor. ठीक है. The stage 1 of labor is from the beginning of uterine contraction till the complete dilation of cervix. Stage 2 of labor from the complete dilatation of the cervix till the delivery of baby. Stage 3 is the from the delivery of baby till the delivery of placenta. The stage 4 is from the delivery of placenta till 1 hour or 2 hour of observation after delivery. Next question. Bulging sac-like lesion filled with spinal fluid and spinal cord element. Bulging sac-like lesion filled with spinal cord and spinal cord element. Options: hydrocephalus, myelomeningocele, meningocele, spina bifida, occulta. Bulging sac-like lesion, a lesion with spinal fluid and spinal cord elements. Spinal fluid and spinal cord elements are filled in a sac-like structure. Spinal cord elements and a spinal fluid. Okay, which is known as myelomeningocele. Okay, myelomeningocele. Next question. The following are the presenting symptoms of patients with catatonic schizophrenia except. Following are presenting symptoms of patient with catatonic schizophrenia except. Options: sudden onset of mutism, have dangerous periods of agitation and explosive behavior, disorganized behavior and speech, stereotyped position with the waxy flexibility. Answer is option C. They are asking exception from the symptoms of patients with catatonic schizophrenia. Actually, the symptoms of catatonic schizophrenia patients are sudden onset of mutism, have dangerous periods of agitation and explosive behavior, and stereotyped position with waxy flexibility. Okay, next question. The brain region which is responsible for coordination of voluntary muscular movement, posture and balance. The brain region which is responsible for coordination of voluntary muscular movement, posture and balance. Options are medulla oblongata, cerebral cortex, spinal cord and cerebellum. Options are medulla oblongata, cerebral cortex, spinal cord and cerebellum. The answer is cerebellum. Everyone knows this. For fine and voluntary muscular movements, for voluntary coordination of voluntary muscular movements, posture, balance, everything is controlled by the cerebellum. Okay. Next question. The complications for ventricular septal defect are all of the following except. Complications for ventricular septal defect are all of the following except. Options are pulmonary hypertension, cerebral palsy, endocarditis, heart failure. The complications of ventricular septal defect are pulmonary hypertension, endocarditis will be there and heart failure will be there. The exception or the answer is Here the question's answer is option B, cerebral palsy. Next question. The main clinical manifestation of pulmonary edema are all except. The main clinical manifestation of pulmonary edema are all except. Here is also the negative question is coming. Exception they are asking. Options are cyanosis, caught with expectoration, option C hypertension, and option D dyspnea. Okay. The right answer is hypotension. Here it is a correction. It's not hypertension, it is a hypotension. Okay. This is the right answer here. Hypotension. The main clinical manifestations of pulmonary edema are all except. The right answer is C, hypotension. Next question. Principles of ethical practice include the following except. Principles of ethical practice include the following except. Options are malfeasance, beneficence, justice, respect for autonomy. Malfeasance, beneficence, justice, respect for autonomy. They are asking the question is principles of ethical practice include the following. Here the answer is malfeasance. Actually the ethical principle is non-malfeasance, non-harm to others. Okay. Next question. The patient with appendicitis usually exhibit the following clinical manifestation. Patient with appendicitis usually exhibits the following clinical manifestations. Options: rebound tenderness at the McBurney's point. Option B, pain occurs immediately after eating. Option C, heartburn, regurgitation and dysphagia. Hematemesis or melena is the last option. So answer is rebound tenderness at the McBurney's point, McBurney's sign. Okay. Next question. To encourage an infant's cognitive and psychosocial development, parents and other caregivers should. To encourage an infant's cognitive and psychosocial development, parents and other caregivers should. Options: allow the baby to play alone several hours each day. Option B, firmly explain the rules of acceptable behavior. Option C, giving loving consistent care including playing. Option D, keep the baby with them at all times so he or she is safe. Here the answer is option C, give loving consistent care including play. Next question. Alcohol withdrawal symptoms are as follows except. Alcohol withdrawal symptoms are as follows except. Option A, anxiety and insomnia. Option B, euphoria. Option C, tremor. And option D, hallucination. It is very easier question. The answer is euphoria. Option B. It is an exception question. Euphoria is the normal mood. Baki sab anxiety and insomnia, tremor and hallucinations will be there for a patients with alcohol withdrawal symptom or syndrome. Next question. The level of care which is oriented toward the promotion and maintenance of health, the prevention of community disease, the management of common episodic disease, and the monitoring of stable or chronic conditions. Once more, the level of care which is oriented toward the promotion and maintenance of health. First point is promotion and maintenance of health, the prevention of community disease, the management of common episodic disease, and the monitoring of stable or chronic condition. Which level of care it is? Option A, primary care level. Option B, secondary care level. Option C, advanced care level. And option D, tertiary care level. Here the answer is option A, primary care level. With primary care level, we will focus on the promotion and maintenance of health, the prevention of community diseases, the management of common episodic diseases, and the monitoring of stable or chronic conditions. Next question. Mantoux test is significantly positive when the erythema measures. Mantoux test is significantly positive when the erythema measures. Options. Option A 5 mm to 10 mm, 10 mm to 14 mm, 14.9 mm, and option C 15 mm or greater. Option D 3.5 mm to 9.9 mm. When we are calling the Mantoux test, it is significantly positive. Here the answer is option C 15 mm or greater. Usually we will say like above 10 mm also we will say like it is a positive. Here one point is there, it is significantly positive when the erythema measures 15 mm or greater. For some patients, the erythema induration will be in between 5 to 10 millimeters. For that patients also will be positive if those patients are having HIV like infections, like they are having some immunocompromised conditions. For healthier individuals, it will be greater than 10 millimeter. If it is a significant, it is 15 millimeter. Next question. Repetitive, uncontrollable thoughts and acts. Example, some rituals, rigidity and inflexibility is termed as. Repetitive, uncontrollable thoughts and acts. Example, rituals, rigidity and inflexibility is termed as. It is in the word only, repetitive, uncontrollable thoughts and acts. Okay. Options: ritualistic behavior, phobias, obsessive compulsive disorder, and apprehension. The answer is option C, obsessive compulsive disorder. Next question. In what ways could hepatitis A virus be spread in if one of the kitchen employees is in the reservoir? In what ways could hepatitis A virus be spread in if one of the kitchen employees is in the reservoir? Option A, while he speaks and sneezes through droplet route. Option B, oral fecal route through his hands. Option C, if he sustains a cut through bloodborne. And option D, while he coughs out through airborne route. Here the answer is option B. Everyone knows that hepatitis A, the mode of transmission is orophycal route through his hands. Next question. Tumors within sella turcica and small adenomas of the pituitary gland can be removed through. Tumors within sella turcica and small adenomas of the pituitary glands can be removed through. Options: infratentorial approach, transsphenoidal approach, supratentorial approach, and craniotomy. Usually we are using the transsphenoidal approach. Here the answer is transsphenoidal approach. Next question. Patient complains of pain and has redness with the swelling at the site of IV. The nurse must. Patient complains of pain and has redness with the swelling at the site of IV. The nurse must. Options: stop infusion and remove IV cannula. Option B, start nasal oxygen. Option C, change IV tubing and solution. Option D, apply warm moist pack to the reddened area. Here the answer is option A, stop infusion and remove IV cannula. Next question. The commonest drug which is administered during an anaphylactic reaction. The commonest drug which is administered during an anaphylactic reaction. Options: diuretic, injection epinephrine, antibiotic and anticonvulsant. diuretic, injection epinephrine, antibiotic and anticonvulsant. Here the commonest drug which is administered during an anaphylactic reaction is option B, injection epinephrine. Injection epinephrine. Okay. Thank you for listening this video. If you like this video, do subscribe and share this to your friends to study well. Thank you so much for watching.